Hi everybody, this is Dr. James Reade here today, and we're going to go ahead and introduce you to a very important concept that has to do with your health. And it's called the Triad of Health, and it's a vital and essential concept that needs to be understood to achieve better health. Some of you may be familiar with some of these ideas and concepts, and some others, this may be brand new information for you. But the first concept, pivots around discovering and treating the true underlying or root causes of ill health. And achieving true health is never resolved by treating symptoms or by solely relying on medications and surgery. Another concept of the Triad of Health is that there are three categories of triggers that have tremendous influence on your genetic expression, or more specifically, your DNA. And by identifying these triggers and treating them appropriately, you can avoid ill health and live a healthier life. So I wish to emphasize that you are not completely controlled or doomed by your genetics, but there are many things you can do to alter or improve your genetic expression. And by the way, this area of study that examines how these triggers affect your DNA is called epigenetics. We can divide these triggers into three basic categories. The first being biochemical, and I'm also going to add environmental and food. The second category would be physical, structural, along with neurological. And the third would be mental, emotional. I'm also going to add spiritual as well. And at the center of the triangle, or the Triad of Health, you'll see here is DNA and your genes. And DNA is your genetic material that contains the blueprint on how your body works. And these three triggers can modulate the DNA and genetic expression. And any one of these can be a predominant trigger, but most likely it is often a combination of these three main categories of triggers. So let's explore these triggers or categories in a little bit more detail, and also show you how some of these triggers can also interact with one another, leading to many different health issues. The first trigger or category we'll discuss here will be mental, emotional, and spiritual. And I wanted to point out that chronic levels of stress can cause changes in stress hormones such as cortisol. Now, cortisol is a steroid hormone, and like other steroid hormones, has the unique ability to directly affect your DNA inside the nucleus of your cell. And cortisol will often cause many genes coded for inflammation to be expressed, and it will have a huge impact on blood sugar levels, insulin production, carbohydrate, protein, and fat utilization in your body. So you can actually gain weight. The altered blood sugar can also influence your brain chemicals, such as serotonin and dopamine. And this alteration can lead to depressive and other emotional states. Chronic stress can also lead to elevated blood pressure, lack of sleep, depressed immunity, changes in other hormonal levels, and many other health issues. So our mental and emotional health can also be influenced by our attitude about life, the people we hang around with, our work environment, family and other close personal relationships, our level of spirituality, and many other factors as well. So these are just some examples of how mental and emotional triggers can affect your genetic expression and health. The second trigger that we're going to discuss here today will be physical, structural, and neurological. And most people who have been to a chiropractic physician completely understand this concept. They realize that when there's a lack of proper spinal or joint motion, that this often results in pain, muscle spasms, muscle weakness, postural distortion, numbness, headaches, and so on. And the conventional means of treating these inflammatory changes is essentially by treating these symptoms. A much better and less invasive alternative is by correcting the joint alignment, removing nerve irritation, balancing the muscles and fascia, which are critical in truly resolving these issues. I did want to mention at this point that the structure of the body is also truly integrated, even at a cellular and a DNA level. And in each of these cells, there is what is called a cytoskeleton. And this consists of different protein structures, and they enter the nucleus of the cell and have influence directly on your chromosomes and DNA expression. And research is currently being done to see this direct influence on the DNA expression. The cytoskeleton in the cell also has fibers that reach outside of the cell, and they're referred to as integrins. Now, these fibers connect to other cells around them, to the surrounding connective tissue called fascia. And fascia surrounds most all structures and organs of your body, such as your muscles, bones, nerves, blood vessels, lymphatic vessels, and so on. So, in saying this, the distortion of your body tissues can potentially influence your DNA expression. Now, let's consider excessive weight and excessive fat accumulation in the body as a physical trigger. The additional weight obviously can place great structural strains on your lower back and other joints such as your hips and knees. This can eventually lead to joint and cartilage damage and pain. Also wanted to point out that do you realize that increased fat accumulation in your body that you will automatically produce more inflammatory products in your body and that you are more subject to inflammation, diabetes, and other health issues? Are you beginning to see, these connections between the different triggers? The very last category or trigger that I'd like to discuss would be biochemical and environmental and also food. Well, excessive consumption of sugar can lead to alterations in chemicals in the brain called neurotransmitters and even throughout the body. And of course, this can lead to gaining weight. It can cause an increase in cholesterol, increases in inflammatory free radicals in your body. It can lead to bone loss, increases in the likelihood of brain degeneration, and will alter the gut biome and many other problems. Now, consumption of hydrogenated fats, such as margarine, fried foods, or overconsumption of omega-6 fats can lead to generalized inflammation and especially joint pain, muscle pain, and stiffness. Eating nutrient-poor foods such as a high carbohydrate diet could lead to multiple vitamin and mineral deficiencies. One example might be magnesium deficiency. And when this occurs, it can lead to elevated blood pressure, increased heart rate, fatigue, muscle soreness, and stiffness. Another food-related issue would be the consumption of foods that you are allergic to, sensitive, or have an intolerance. And often these problems can have an underlying genetic component, but often there are pre-existing digestive imbalances that need to be corrected. And these types of problems with certain foods can manifest itself as digestive problems, skin issues such as eczema, brain fog, fibromyalgia, swelling in the joints, autoimmune issues, and many other symptoms and health issues. So, in some examples of environmental or outside influences could be due to exposure to viruses, bacteria, fungi, and parasites. And this often activates different genes, especially in your immune cells, to react to these infections, which can result in inflammation, fever, fatigue, and tissue damage if not taken care of properly. And in these situations, you may require some medication for a period of time. Another example of environmental influences may be due to different chemicals in our environment, such as pesticides, herbicides, such as glyphosate, or known as Roundup, plastics, phthalates, petroleum byproducts, and heavy metals. And some of these particular types of compounds are known to disrupt your hormones. They may interfere with numerous biochemical reactions in your body as well, and some have been linked to cancerous changes in the tissue cells. So in summary, to go ahead and put this all together here with the Triad of Health, all these parts of the triad can influence one another. An example would be someone who does not exercise. This leads to weight gain. This can lead to depression, and depression can be due to, of course, a change in some of the brain chemicals. This could lead to poor food choices, which can lead to vitamin, mineral, and nutritional imbalances, and subsequently other health issues. So what we do here in our office is identify these triggers and treat the root causes of various health issues. As one example, if someone has elevated cholesterol, they are often prescribed a cholesterol-lowering medication without identifying why the cholesterol is elevated. And often these medications can lead to an important nutrient deficiency, such as coenzyme Q10, which affects our metabolism and can increase the likelihood of cardiovascular problems when deficient. So we could potentially be creating more problems with this approach. In my opinion, a better approach would be to make appropriate diet changes, such as a reduction in carbohydrates, recommend certain supplements to help restore better liver function, probiotics, which could help to normalize the gut microbiome, and then certain exercises should also be done. So in summary, you do actually have the ability to influence your genetic expression and improve your health. I hope this discussion was encouraging and helpful. And I want to thank you for listening. And if you need any further help, please call myself, Dr. Reade, at my office at 480-732-0911. Once again, thank you very much.